So I'm a big proponent of interferon. So yes, I definitely think people are getting more comfortable with it. I get contacted by people all over the country when they're seeing a young patient, and I often talk to them about interferon. Certainly if I give talks anywhere, especially in academic centers with fellows and junior faculty in the pediatric hemonc world, I'm really encouraging people to use it. So I definitely think people have expressed to me more comfort in using it and have been using it more frequently in young patients. We actually published a position paper last year, sort of raising the point that now that we have an approved product, Ropeginterferon, it's a really good time to think about doing a clinical trial with a cooperative group in young patients. So that's something I'm hoping we'll be able to make progress on and actually be able to consider doing. A lot of what we do in pediatrics is extrapolated from adult medicine. So being able to actually do a clinical trial and potentially get an approval for a drug in kids with MPNs, that would be huge for the field and really the first of its kind. So I do love interferon, and I've been using it pretty regularly, but I think a lot of my colleagues in pediatric medicine have gotten more comfortable over the past couple of years as we've published some more literature on this, as we've started using it more, as we've recommended it more and people have heard about it more. I think it's now something that my colleagues in pediatric hematology are actually more comfortable with. So I think that's great because I know a lot of patients have really benefited from it.